Dr. Allyson Maske is a member of internationally known Atlanta Plastic Surgery, and she's one of the premier surgeons in Atlanta in the area of breast enhancement. She recently sat down with us and talked about the various techniques she uses to achieve the optimal result for each of her patients. Here's Dr. Allyson Maske.
Breast enhancement is typically thought of as just a true breast augmentation, which is we do all the time and is the right procedure for many patients. But other patients can need a breast lift. Some patients have too much breast tissue and need a breast reduction. Occasionally, we can do procedures that are combinations of multiples of these procedures, but for each patient, we can normally find something to reach the best outcome for them. You know, I've been asked before if there is a perfect breast size and shape. And the answer is that most women have in their heads what is the perfect breast size and shape for them. And that may not be what is perfect anatomically or what society sees as perfect. So my goal is to listen to each patient and help them achieve that look which is perfect for them as an individual. Another question which I have been asked is, can you be too old or too young for breast enhancement? Well, let's start with too young. You can be too young to have breast implants. There are limits on the age that which, number one, we feel as doctors is appropriate to augment a breast because breasts continue to grow until people are in their early 20s, and the implant companies will not allow implants to go into people that are too young. But other procedures can be necessary on younger patients, secondary to deformities, or possibly that their breasts have grown too large when they're younger. So even teenagers may have certain kinds of breast enhancements. There probably isn't an age limit for being too old for any type of breast enhancement. We've even worked on patients in their 80s and done things that they are very satisfied with. So it just really depends on the particular patient. Many patients have a question about whether or not they need an implant or a breast lift or mastopexy. These are often women that have breastfed their children or they've just had some sagging with age. So the biggest question is, does the patient want to be bigger than her current size? A breast lift only lifts the tissue that is there and may possibly make the breast just a little bit smaller. An implant is utilized in order to make the breast bigger. So sometimes we may need one procedure or the other, and oftentimes we may need a combination of the procedures in order to give the patient the look that she is attempting to achieve. We are often asked questions about whether or not any breast enhancement procedure will affect things like sensation, breastfeeding, and possible mammography in the future. In general, all of these things will be normal after surgery, but there are specific instances that can affect those three things. This would be something I would go over with each patient in detail in that initial consult, and certainly the final outcome outweighs any of these potential changes. I do not think that these procedures are purely cosmetic at all. When looking at the breast enhancement procedures as a whole and including implants, mastopexies, and reductions, these are procedures that can change a woman's life. They can change what she's able to do with her life and certainly change the way that she sees herself.